Hello there, it's Luke, and in this tutorial we're going to be looking and considering neurogenic shock and the different physiological processes that give us the signs and symptoms that we might see in a patient with neurogenic shock. So, as you recall, we said that shock is a failure of blood supply, failure of oxygen and nutrients getting to the tissues, and a failure of the blood supply removing waste products and carbon dioxide and toxins so that they can be excreted. And neurogenic shock is a type of distributive shock, by which we mean that there's not necessarily a problem with the heart pump itself, and there's not necessarily a loss of fluid or blood from the body, but the fluid or blood that there is there is in the wrong places. So there are three sort of main types of distributive shock, if you like: neurogenic, which we'll discuss just now, and anaphylaxis and sepsis, which we will discuss in other tutorials. They deserve a bit more time than sort of all crammed into one. So what are the signs that we might see with somebody with neurogenic shock? Well, they might have unexpectedly sort of warm, very pink sort of peripheries with a decreased refill time. So it might be rapid. It's sort of quite unexpected for somebody with a shock state, and they also may or may not have a sort of decrease in their heart rate. And these are the symptoms that we'll focus on in this tutorial. Of course, they may have all sorts of other injuries or other signs of sort of illness or injury affecting the central nervous system and peripheral nervous system. So you'll no doubt be aware by now that there's smooth muscle within the blood vessels, and this is in part under the control of the autonomic nervous system. And so efferent nervous impulses, so nerve impulses from the central nervous system out to the peripheries, controls the lumen, controls how relaxed or constricted that smooth muscle is, and that gives us our vasoconstriction or vasodilatation. So under normal circumstances, there's frequent impulses travelling from the central nervous system out to the peripheries and out to the blood vessels within the peripheries that are keeping the tone of the other blood vessels just right. Now, if you have a spinal cord injury, then anything below the level of the injury may mean that you get impairment of that efferent impulse travelling along the nerves. There may not even be any sort of efferent impulse, and so your blood vessels, the smooth muscle within the blood vessels, isn't being told to contract, and so it will dilate, and that dilatation will lead to a drop in your systemic vascular resistance and will lead to a drop in your blood pressure. And also, because it's all dilated, the blood is sort of spread out throughout the body towards the peripheries, the capacitance vessels and all the rest of it, and so there's less venous return back to the heart. There'll be less preload, less stroke volume for these reasons, and so both of these things will impact on the blood pressure. Now, we mentioned just now that there may or may not be changes to the heart rate, and the heart rate may indeed get slower. And the heart rate is under sort of dual control, if you like. It's under sympathetic stimulation to make it go faster, and parasympathetic stimulation to slow it down. And the nerves that control this, so we've got the vagus nerve up here that arises from the brainstem and goes sort of directly to the heart, and that will slow the heart down. It's parasympathetic nervous impulses. And then the sympathetic cardiac nerves that speed the heart up arise a little bit further down towards a sort of thoracic area of the spinal cord and the sort of the ganglia that arise from there. Now, if we have an injury that is sort of beneath the level, obviously, of the brainstem, we will still have that parasympathetic impulse slowing the heart down, but it won't be balanced by the sympathetic impulses that arise further down than where the injury is. And so your heart won't be told to be speeding up by these nerve impulses here. It'll only be told to slow down by the sort of vagal nerve impulse. And so whilst you might have somebody with a very low blood pressure, you don't get that normal speeding up of the heart depending on the level of the spinal cord injury. And so you may have a sort of bradycardia, a slow heart rate in this shocked patient. And again, this slide's just repeating that really. You get a decrease in the frequency of the efferent impulses from the central nervous system, which control everything, out to the peripheries, by which I mean the heart in this instance. And you get this slowing of heart rate and also the reducing contractility because they're not being told by that nervous impulse to beat harder and faster. And you get this combination of all three things, loss of vasomotor tone, loss of preload, and a slowing of the heart rate, and this will drop your blood pressure drastically. So in summary, neurogenic shock is a type of distributive shock. The main cause is vasodilatation, which will result in a loss of preload, leading to a loss of blood pressure. And when we examine our patients, they may feel very warm. They may have a rapid capillary refill time because actually all the blood and all the fluid is in the peripheries. However, if the spinal cord injury is high up, say towards the neck somewhere, for instance, and there's a lack of sympathetic impulse getting to the heart, then actually you may find that the heart rate decreases as well, and that explains that sign. Thank you very, very much for listening.